Hi and welcome to Fertile Minds. I'm Dr. Ritu Rana, a fertility specialist at Queensland Fertility Group. Today we are exploring when surgery may be needed to help with fertility. Fertility surgery is considered when structural problems in the uterus or pelvis interfere with natural conception or pregnancy. Some of the main conditions that may need fertility surgery include fallopian tube problems like blocked fallopian tubes or swollen fallopian tubes called hydrosalpinges, uterine conditions like fibroids, septums, polyps or Asherman syndrome where a scar tissue grows inside the uterus, endometriosis, ovarian cyst, and sometimes male factor issues like varicocele, or when we need to retrieve sperm from the testicles by surgical technique. Great question. Surgery for infertility isn't the first step in most cases. It's usually considered after a fertility assessment and only if the problem is structural and clearly interfering with conception. Surgery is sometimes recommended after an unsuccessful IVF in order to enhance the chance of success before repeating IVF. Fertility surgery can involve different approaches depending on the condition. Most are now minimally invasive like laparoscopy and hysteroscopy, which means a faster recovery and less scarring. Sometimes rarely, an open surgery is required where we have to make a cut in the tummy. For men, surgery that may be needed sometimes is sperm retrieval procedure where we collect sperm directly from the testicles or the epididymis in men with azoospermia. Both are minimally invasive surgeries, but they are used for very different purposes in fertility care. In hysteroscopy, a thin telescope with a camera is inserted through the vagina and cervix into the uterus. It is done to remove uterine polyps, fibroids, septums, and to treat intrauterine adhesions or scar tissue. It is done under general anesthesia and the recovery is very quick, usually same day. Laparoscopy involves a few small cuts in the belly and a camera and instruments are inserted through these cuts. The abdomen is inflated with gas. Areas that can be treated with surgery is the area outside the uterus, the fallopian tubes, the ovaries, and the pelvic cavity. This also involves a general anesthesia, and the recovery may take up to 1 week. Yes, in selected situations, surgery can significantly improve IVF success, but it depends on the underlying problem. Surgery before IVF is recommended only when there is a correctable problem known to reduce IVF success, like swollen fallopian tubes, uterine cavity problems, large obstructive ovarian cyst. Otherwise, it may delay treatment without any extra benefit. That is such an important question to ask before going ahead with any fertility surgery. Because while surgery can correct problems that reduce fertility, it can also sometimes affect egg reserve or long-term fertility. Particularly surgery for ovarian cyst removal may remove some healthy ovarian tissue along with the cyst wall. This can lower the egg reserve. Risk is higher with repeat surgery or with very large cyst. As a general rule of thumb, we wait for a month for minor surgeries, about 2 to 3 months after more complex surgery like ovarian cyst removal and complex endometriosis surgery, and up to 3 months after major surgery like removal of fibroids, which is called myomectomy. My gentle advice would be to allow yourself to be nervous, but also remind yourself why you are doing this. Not as a setback, but as an investment in your future family. Many say that once they understood the purpose of surgery, they felt empowered and they felt they had taken a positive step towards achieving a pregnancy. Thanks for watching. Don't forget to subscribe for more fertility insights and expert advice.